Chief Medical Correspondent Dr. Jon LaPook joins us now. John, good morning.
Good morning.
So they have lifted quarantine of Mr. Duncan's family. What are the implications of that?
Yeah, obviously it's good for his family, but there's also good implications for the people who were possibly exposed to Nurse Vincent. Because think about it, Mr. Duncan was sent out of the emergency room after he had a fever of 103, and he got sicker and sicker after that. And Nurse Vincent had a fever of 99.5, so presumably she was less sick. And we do know that the amount of virus in your blood is much less at the very beginning of the illness, so therefore it's less likely that you're going to infect anybody.
I mean, this is really big news. It means that this is not spread beyond this. What about, though, these new guidelines from the CDC? They're much stricter than before.
Yeah, and I think it makes sense. You know, it's one thing to make a mistake. In medicine, it's an eternally humbling profession. You make mistakes. The sin is not to learn from those mistakes. So it would bother me if people just said, our protocols are fine, and we're not going to change them. But the CDC has said, you know something? They didn't seem to work. We're going to make them more strict.
So now they're saying there can be no exposed skin for healthcare workers.
I just, a minute ago, right before I came here, said to the CDC spokesperson, when are they coming out? He said, can't say for sure, but probably by today.
Another new development is a SWAT team, both at the Pentagon and CDC has their own. What are they going to do?
I think they're going to make sure that that in practice things get done as opposed to in theory. So they're going to go down there, they're going to have previous experience, they're going to make sure that not only are you reading the instructions, but you're doing the instructions, because they'll have it based on personal experience.
So you see this as that if there's another small outbreak of Ebola, that the Pentagon could send in this 30-person team?
Well, you know, the CDC has talked about their SWAT team. The Pentagon is talking about this other team. So I think coordination is very important. You don't want to have it like the fire department and the police department coming to a site of an emergency and saying who's in charge. So I think coordination is going to be very important. But I do like the concept of making sure that, hey, are you doing it the right way?
Thank you, John.
Thank you.